postcentral gyri are located between the pars anteriorly and supramarginal gyri posteriorly. The precentral gyrus is broken into the two gyral strips. As you can see here, the precentral gyrus is being broken into the two gyral strips, while the precentral circle it's behind the precentral circle posteriorly to the central sulcus, and ahead of it central sulcus is the postcentral gyrus. Here you can see the ascending ramus of the cingulate sulcus, which extends up to the posterior edge of the precentral lobule formed by the upper end of the pre and postcentral gyrus overlapping onto the medial surface of hemisphere. The parieto-occipital and calcarine sulci on.
Where is the cingulate sulcus again? Show me. Is it present over there?
No, it's underneath that. Basically, it's demarcation on the lateral surface. Oh, lateral surface, sorry. So it's being further dissected to show. It's basically the demarcation by pins. So the parietal occipital and calcarine sulci on the medial surface converge and join into the Y-shaped configuration, as shown here. The parietal occipital sulcus and calcarine sulcus. These are basically the pins that are being used to demarcate the position of parts of occipital sulcus and calcarine sulcus on the lateral surface. So here is the part of right frontal and parietal lobes in front and behind, and the postcentral gyri and central sulcus has been removed. So you can see the right frontal parietal lobes in front and behind the pre and postcentral gyrus are being removed. The precentral sulcus is located lateral to the posterior body of the ventricle, and the posterior gyrus is located lateral to the anterior part of the atrium. Here you can see precentral gyrus and postcentral gyrus located to the lateral to the posterior part of the atrium, ventricle, sorry. The postcentral gyrus is located lateral to the anterior part of atrium. Both gyri adjoining the sylvian fissure are positioned lateral to the splenium of corpus callosum. So you can see here the lateral surface is exacted. So the splenium of corpus callosum body, these are present lateral to the splenium of corpus callosum. Here is the superior lateral view of left frontal lobe. The frontal lobe is often depicted as being split into the three gyri, superior, middle, and inferior by two sulci. Here is the superior, middle, and inferior gyruses and sulci. The superior frontal gyrus is split into medial and lateral segments, while the middle frontal gyrus does not have a smooth unbroken surface but is broken into multiple tortuous segments. The superior lateral view of left frontal lobe. The frontal lobe is often depicted as being split into three gyri, superior, middle, and inferior by two sulci, superior and inferior. Often as shown the superior frontal gyrus, the middle frontal gyrus does not have smooth broken surface but is broken into multiple tortuous. So you can see superior frontal sulcus, while the inferior frontal sulcus and middle frontal sulcus gyrus is solid. The right temporal lobe with more typical pattern in which three temporal gyri. You can see the superior temporal gyrus, the middle temporal gyrus, and the middle inferior temporal gyrus, sulcuses and malleus. The sulci have irregular tortuous course but are largely continuous along the lateral temporal lobe from anterior to posterior. So you can see superior temporal gyrus. So, sir, this was it for sulci and gyrus. So remaining was up to the sylvian and cinsula was covered in previous slide. So
this was the only presentation that was left?
Yes, sir.
And okay, we should have covered this last week. I mean, it was too short for presentation.
Yes, sir.
Um, so, anyways, this was just a revision. We finished our the Roton neuroanatomy session. The schedule that we had, we finished this a couple of weeks back, and this was just a revision. This was the continuation of the second session. I'm sorry that this was such a short presentation. We'll start with our regular presentation from next week on, and if there are any questions, we'll be happy to take it. If there's any question from the participant, they can use the chat box to ask. I am again sorry that this was such a short presentation because since it was a continuation from last week. If there's no questions, then we'll have to conclude this session. Next week, we'll start with our regular sessions. And the idea behind this session is to follow Roton neuroanatomy. And if there's anyone who's willing, who wants to present other than our own institute, you guys can always leave us a message or maybe an email saying so. So if there are no questions, we'd like to conclude the session, Dr. Zohaib. Thank you for the presentation. You need to work on it. And next time, if the presentation is so short, please tell us in advance so that we can add some other topic as well. Thank you, guys. Thank you for joining.